back.
2, 3.
Gotta keep going.
4. This is sugar in case you don't know what I'm doing.
Yeah.
5 teaspoons. 6, 7, 8, 9, 10. That's in a small, or what, a 10-ounce soda?
That's in a 12-ounce can.
12-ounce can of soda. That much sugar.
Yeah.
Y'all be very careful. Make one soda last a whole week. If you must have it, wean yourself.
Yeah.
Wean yourself. I think I did that about 2 years ago. Cut back on sodas, so.
That's good.
That's good. What else did you bring this morning? Coleman Dental Group here with us this morning. Dr. Alan Coleman, Dr. Patrick English, and of course, Miss Lisa Coleman. How are you guys?
We're great.
Good.
Hello.
Great.
Really good.
Now that you guys got, and that's just one. How many times do we have more than one soda
Yeah.
in a day with all of it in there? So that's bad. But you also brought another little item in here. What'd you bring?
We have a lot of patients who don't really like to floss.
Why is that?
I don't know. I hear all kinds of stories as a hygienist. I don't know if you doctors hear stories about why they don't like
Why they don't like to floss?
Or maybe they say they floss and
But you guys can tell.
yeah.
I mean, we're guilty. If your teeth are bleeding when you're sitting in that chair and flossing, they know. And you're like, oh, I just haven't done it this week.
Yeah.
Y'all know.
Yeah, we know.
Why is it we always wait till like, okay, a week before we go to the dentist? I got to make sure I do this all the time. I'm bad to wear my trays when I know I'm coming in to see you.
I know.
Straighten
But it's
those
okay.
teeth.
But it's all right. But I tell you, guys really love tools, really love gadgets.
Okay.
This is a really fun gadget right here. This is a water pick that you can use in the shower.
Ah,
So you know how the kids really make a mess?
yes.
And they get water just all over the mirror
All over
and
the
all
sink.
over the sink.
Yes.
And when I say kids, I'm talking about your husbands
Adults.
too.
Yes. Adult boys.
Adult boys. This they can take in the shower, and the shower's
Make a
already
mess all
wet,
they
and
want.
they can already make a mess.
Huh.
So, and it's ready to turn on, and I don't
Yeah,
want to make a
where's
mess
Jamie?
all over your set. But
Point it toward them.
Need to demonstrate it on Jamie.
Yeah.
Hey, Jamie, come here.
Jamie, come here. It doesn't matter. He can change his shirt.
I'll show you some.
So
Ready?
you do is you turn it on. Turn it up. Wow, that's got pretty good range.
yeah, it really does.
So when you're in the shower, you
It's got a lot of power.
So you're,
You point this tip right
Okay.
here at your gum line, and you know how your gum line is just kind of scalloped around your tooth? You just
Right.
kind of work your way around, and it works just like floss. It just blasts that plaque and that bacteria
Really?
right out from between, and it works.
no pain.
Why would I need a dentist?
Well, you
You
still
still
have
need to
to
come see
floss.
us every 6 months,
Yeah.
Jamie, or 4 months, or 3 months, or whatever, you know, your
Something,
doctor,
right?
your dentist says. But it works just like floss.
That's neat.
It's really as effective or more effective, especially if you're unable to floss, properly.
Yeah, 'cause some people just rush.
Well, I mean, it requires some dexterity to floss.
floss.
And this, it doesn't require as much.
Dr. English, some people have their teeth that, it's kind of hard to get the floss up in between those back teeth, a little bit tighter areas. Perfect for that.
Well, I know especially for patients with bridge work, things like that, where you have to use flossers or special implements to get in.
Right.
If you've got some tighter contacts and things, it's just an excellent way to get in those spaces. And especially when we're all rushed in the morning, it's kind of like I was trying to get here today. So
Jump in the shower, just hurry up, do it all, brush your teeth, get out the door.
Yeah.
Good. Well, the one thing we always talking about is there was an article having, if you have a cat, you have a 40% chance of not having a heart attack, which is unbelievable to me. So everybody wants to hurry up and rush out and get a cat. But also it talks about flossing and heart disease, and that is so important. And something you can tell when you go to the dentist if they've got some of these diseases. So it's
Right.
very important to
Yep.
floss.
Floss and brush.
Yeah. The name of the game
Be
is
healthier.
just getting rid of bacteria in your mouth. So,
And it can build up. We all have those areas where you go in for your cleaning and there's a little bit of, they have to take a little bit of time. Mine happens to be just in the back of my bottom teeth. So they're like, just make sure you do this and I'll take care of it. And it does.
your toothbrush really only reaches about 40% of the tooth surface. The rest of it is, where the teeth touch. So that's where you need to use floss. You need to use something to get between the teeth to get that bacteria out of there.
I know you doctors have seen patients come in that have put it off, and then they're at the point where, oh, I shouldn't have done this. And we all know that, but why do we do it?
I don't know, human nature.
Human.
Yeah.
Human. What I like about Coleman Dental Group is, you know, they also have that camera where they'll put it on your teeth and you can show them. If you want to put something off, they're going to be able to show you what it's going to look like the next time you come in. Don't put it off too long. It's going to be a whole lot worse to fix, or a longer procedure, or even be more not effective, but cost you more if it turns into a root canal versus just a cavity, something like that. Alan, you brought something in, Dr. Coleman that is, you brought something in this morning that's right here, and I have no idea what it is, but it is bruxism, is that right?
Bruxism.
Bruxism? What is bruxism?
Night grinding. And it seems to be on the increase, especially in children.
Yeah.
Some of the medications that are being used have an effect, but for children, we seem to think a lot of them grow out of it, but it could be related to their muscles not developing yet, but it can progress into adulthood, and it's, you know, the symptoms are headaches, earaches, teeth hurting, worn teeth. It's something that it's so frequent, so common, we consider it as normal, but it's really not a normal condition. It's actually been reclassified as a sleep disorder, like sleepwalking and restless leg syndromes.
With those mouthpieces that you just experienced, can children wear those as well?
Well, they haven't been proven as effective in the primary dentition, you know, for children, but they're definitely effective for adults.
Okay, great. And you wear yours and you swear that's what, that 17% extra strength, power,
That's
energy?
a little different than the actual night guards for the bruxism, but it's the same concept. It's the same mouth guard concept, and it's you know, basically a lot of times a stress habit. So.
Yeah. And it is, and I know, I mean, I've been around a child where they've been asleep and all of a sudden you hear them grind their teeth and it's just,
Oh, yeah, it's annoying.
It just gives you chills too, and you have to imagine what they're doing in their teeth. So parents, if you notice the children doing that too, contact Coleman Dental Group. There's the number, 232-0789. Open until midnight. No, they're open at 7 p.m.
7 p.m.
They're like, wait a minute here, we're not staying open until midnight.
That would be really cool.
Yeah, you guys were just watching him
That would
play,
be cool.
listening to him play last night. But anyway, spring forward, do not forget to change your clocks. You'll be late for church Sunday, should you be going. Spring forward, turn that clock up 1 hour Saturday night or first thing Sunday morning when you wake up. All right, Coleman Dental Group taking new patients, accepting most insurances anyway, so call them, schedule that appointment. Anything else you want to add?
First step's the hardest. Just come
It
in
is, just
and
getting in there.
come in.
Guarantee you'll like the experience. I can promise you that. All right, we're going to go over to Barry Kay. Thank you guys for being with us this morning. Going over to Barry Kay, one last song on this Friday morning. Have a wonderful weekend. It's going to be beautiful. We'll see you at the Home and Garden Show this weekend. Bye-bye.